Very good afternoon, everyone. I'm Dr. Vivek Baliga. I'm a practicing physician at Baliga Diagnostics in Bangalore. And today I'm going to discuss the lifestyle management of patients with diabetes who have had heart attacks. Now, you will know that diabetes is a very common problem in our country. And in India, there is estimated around 65 million people have diabetes. And that number is believed to increase to around 110 million in the next 10 years or so. So given that it is such a robust problem, it is not uncommon or surprising to find that a lot of patients with this condition can develop heart disease in the future. The problem is that patients who have diabetes are around 2 to 6 times more likely to develop a heart attack compared to those who do not have diabetes. This means that a large number of patients with diabetes will require admission to hospital. They may require treatment for complications, numerous clinic visits. These sort of things can be quite a problem in patients who have diabetes. Now, what we need to do as doctors and you as patients is to make sure that if you do have diabetes is to keep good control of blood sugar so that you can reduce these complications and reduce the chance of developing heart attacks and suffering from a heart attack or heart failure in the future. Now, before I go ahead as to how you can manage diabetes and heart attacks with lifestyle modifications, I'll just briefly talk about heart attacks itself to you. So what you need to understand first is what exactly is a heart attack. So if you take a look at the heart muscle itself, the heart is a very selfless organ. It pumps blood to all parts of the body and all the vital tissues in the body. But at the same time, it also requires some blood supply. And this blood supply is maintained through small arteries on the surface of the heart called coronary arteries. Now, as these coronary arteries are always under some degree of stress and are providing blood to the heart muscle, they are also subject to developing aging and developing what we call fat deposition within the arteries. And this fat deposition is something that we call atherosclerosis. The problem with fat deposition is while it is a normal phenomenon in a lot of people, it can be too much in patients with diabetes and it can lead to narrowing or what we call blockages in the arteries. And this is what ultimately leads to heart attacks. Now, if you go on to what are the causes of heart attacks, there are numerous causes ranging from a simple change in diet, lack of exercise, genetic factors, smoking, diabetes, of course, as we're talking about that today, high blood pressure, and these are many of the risk factors that can lead to heart attacks. Each one of them is as important as the other. In India, high blood pressure is the most common reason why patients suffer from heart attacks, followed closely by diabetes and smoking. And a family history of heart disease is also a very common thing. But sedentary lifestyle seems to be catching up. Stress levels seem to be a cause as well of heart disease these days. So these factors have to be addressed if someone is at risk of developing heart disease. So what are the warning signs of heart problems? Well, if you're having a heart attack or you're suffering from chest pain that is due to heart disease, one of the first symptoms that you may experience is chest pain, which is usually in the upper part of the chest, usually around here. It can radiate up to the jaw and sometimes down the left arm. Some people experience the same sort of pain in the back as well. It is often a heaviness that the patients describe. Some people describe it like a stone is being placed on their chest. Some people have gone to the extent of saying like an elephant is sitting on their chest. Associated with this symptom of chest heaviness can be sweating as well, profuse sweating. So you may be in a cold air-conditioned room, but you may start to develop profuse sweating along with the pain. Along with that, some degree of nausea, vomiting sensation, and some people also develop profuse vomiting. Some patients have breathing difficulty as well along with this. So these are the different types of warning signs that may indicate that you're having a heart attack. Now, the problem when patients have diabetes is they may not experience all of these symptoms. So some people may just feel a little bit of tiredness. They may find that they're getting more and more breathless when they're walking, but they're not experiencing chest pain. So all these sort of signs need to be looked out for, or symptoms need to be looked out for, so that you can seek medical attention early. Now, if you are seeking medical attention and you're diagnosed with a heart attack, what are the treatments that you will be subject to? Well, the first thing that you're going to undergo is certain investigations. So the investigations that you'll require is an ECG. An ECG or an electrocardiogram looks at the electrical activity of the heart, and that changes when there is a patient is suffering from a heart attack or if there is reduced circulation of blood to the heart muscle. At the same time, certain blood tests will be performed. One of the blood tests is called a troponin test, and this is an enzyme that is released by the heart muscle when it is being damaged due to reduced blood flow. A troponin test is a very, very sensitive test and is nowadays used as a standard test to diagnose heart attacks. In addition to that, a chest X-ray may be done to look at the size of the heart, and to see if there is any fluid in the heart, around the heart or in the lungs. This can happen in an acute heart attack where the heart doesn't pump effectively and fluid accumulates in the lungs. And finally, another investigation called an echocardiogram or an ultrasound scanning of the heart may be done. And this test lets us know whether there is any damage to the heart muscle, whether the heart muscle is pumping normally, whether there's any part of the heart muscle that is not moving very well. There are lots of pieces of information we can get from these investigations. So once a diagnosis of a heart attack is made, treatment has to begin. So the first treatment that is given is a blood thinner. So aspirin is something that should be taken. Generally, chewable aspirin is given, around 325 milligrams is given to the patient straight away, because this can thin the blood, and if there is a blood clot sitting in the heart arteries, it can dissolve that clot, or at least start the dissolving process. In a heart attack, the primary problem is a blood clot within the heart arteries. Because the artery has become so narrow, the blood thinner cells that are called the platelets become very, very sticky, and they stick together and form a clump that eventually blocks off the arteries. And that is why, in addition to aspirin, sometimes other blood thinners are given, because the agents have to be very powerful to dissolve this blood clot. So agents such as clopidogrel or newer agents such as what called prasugrel and ticagrelor are now being given to start the blood thinning process. Along with that, blood cholesterol lowering agents called statins are given. Now, there has been both positive and negative press about statins, but in an acute heart attack or in patients who have heart disease, it has been time and again proven through clinical studies that these statin agents can help lower cholesterol, but at the same time reduce the stickiness of the platelets, reduce inflammation inside the blood vessels, and actually save patients who are having a heart attack. And in the long term, they can reduce the chance of developing heart attacks as well. In addition to just beta blockers and statins and blood thinners, another medication that is required is a beta blocker. A beta blocker is a drug that slows down the heart rate and allows more blood to flow to the heart muscle when it is relaxing. Now, I mentioned earlier that the heart is a selfless organ. It pumps blood to all the organs of the body. And once it has finished pumping, whatever blood is remained when the heart is relaxing is what the heart takes for its own usage. So if there is a good amount of blood going to the heart muscle when it is relaxing, the heart will remain healthy. But if there is narrowing, it will not remain healthy. There can be some disease. And this is where beta blockers play a very important role. Now, if you are suffering from a heart attack, this medical therapy is not sufficient. Further investigations will be required. And one of the investigations is a test called an angiogram. In an angiogram, there is an injection of dye is done through a small, tiny tube that is inserted into the heart arteries. And this dye helps us figure out where exactly there is narrowing of blockages. Now, if you find a clot or if you find a narrowing that is significant enough to cut off blood supply to the heart, then that has to be opened using a stent. A stent is like a spring in a pen that you have, and that is mounted on a balloon. The balloon is opened up and the spring expands and it sits in the artery and opens up the artery and restores normal blood flow. Obviously, once treatment of patients has taken place for a heart attack, of course, other medications have to be prescribed for diabetes, and anti-diabetic medications have to be given. And there are numerous drugs that have been tested these days that are proven to be safe or improve what we call mortality and long-term heart disease control by controlling blood sugars. Now, moving on after treatment, what are the next steps? Well, even before there is treatment, we should try and prevent in every way possible developing a heart attack in the first place. So you're looking at prevention being better than cure. What are the preventive strategies? Well, stopping smoking is one. Eating a healthy, balanced diet is one. Making sure you get plenty of exercise, maintaining a healthy body weight, keeping your cholesterol low, seeing your doctor on a regular basis, avoiding stress, performing meditation, yoga, relaxation. All these sort of things are essential when it comes to managing heart attacks. So now I'll move on to the actual meat of this talk, which is the lifestyle management. And the whole purpose of lifestyle management in patients with heart disease is to ensure that the heart muscle is getting good quantity of blood, to ensure the heart muscle function is normal, to ensure the overall vital organs are functioning normally, and to prevent what we call cardiovascular morbidity and mortality, that is death from heart disease in the future. And this is extremely important when it comes to managing diabetes, because in diabetes, not just diet matters, not just medication, but other lifestyle changes matter. So the components of lifestyle modifications are numerous. It's not just limited to stopping smoking and taking medication. One of the most important aspects is physical activity. Now, there is a difference between physical activity and regular exercise. Many of us assume that our daily household work is exercise. While that is some degree of exercise, it does not amount to what exercise your body really needs. It is actually just physical activity that most of us do anyway as a part of our daily living. And do bear in mind that you have heart disease and you have diabetes because despite doing regular physical activity. So what you need to do is more exercise. So what sort of exercise is recommended? Well, the American Association and even in India recommends what we call moderate intensity aerobic exercise. That is exercising for at least 30 minutes a day, 5 days a week. Moderate intensity exercise can be brisk walking, running, jogging, swimming, cycling, playing tennis, any sort of racket sports. These sort of things, etc., can be very helpful in reducing heart disease and controlling heart attacks or preventing heart attacks. I understand, and as physicians, we are aware that not everybody can do these sort of exercises due to joint problems, etc. So wherever possible, try and get some sort of extra physical activity in. For example, if you need to go to the second floor of a building, make sure you take the stairs. If you need to go to a nearby shop, don't get on your bike and go to the shop. You might as well just walk to the shop. These sort of things can actually help in the long term. And physical activity has been shown time and again to reduce your chances of developing heart attacks and to prevent any future heart attacks if you have developed any, and also in controlling diabetes. The next aspect is nutrition and diet. We all love our food. In our country, there is a wide variety of foods that are available, but unfortunately, not everything that we love is healthy. When you're looking at diet itself, make sure that you have a healthy, balanced diet. So you're looking at proportions of carbohydrates, proteins, fats, vitamins, minerals, etc. in your diet. All of these components are important, including fats. Make sure that you have some amount of fat in your diet, but don't exceed more than 20% of that in your diet, because extra fat can lead to high cholesterol in the blood, and that in turn can worsen cardiac disease. Fat content is important because it can help you with hormone synthesis. It can help you with maintaining the integrity of cell walls. And similarly, proteins are required to maintain muscle mass, to maintain normal functioning of and development and synthesis of enzymes. And carbohydrates are required for energy. Now, vitamins and minerals are also important. Magnesium, chromium, zinc, etc. are all required for cardiac function. And these can be obtained through plenty of fresh fruits and vegetables eaten on a regular basis. The guidelines currently recommend having around 5 portions of fruits and vegetables, but in India, we generally recommend eating more than that. Just 1 fruit a day is not sufficient. Maybe 2 or 3 types of fruits are important. But make sure you watch your sugars when you're having plenty of fruits, because high fruit intake can sometimes increase the sugar levels in the bloodstream. The next thing to do is to adhere to your medication. Now, your doctor would have prescribed you some medicines to take when you have diabetes and heart disease, and it is important you take these medications on a regular basis. Kindly don't look up the side effects and think you're having a side effect for each and every medication that you're taking. Instead of stopping the medications yourself, talk to your doctor first before you do so, and make sure you take your medicines on time. Psychosocial well-being is also important. It's not just physical health that matters, but also mental health. So socially interacting with other people, maintaining good healthy relationships with people, all this sort of thing matters, because it can prevent anxiety, it can prevent depression, and all of these factors can have a bearing on sugar control and on your heart. So psychosocial well-being is important. If you feel you're suffering from any sort of stress, anxiety, depression, etc., don't hesitate to seek medical attention either from your physician or from a counselor, as this can help you a lot in the long run. Sexual activity is also important. This is sometimes not discussed much by patients with their doctors due to embarrassment, but do remember that it is a part of your daily life. So there is absolutely no shame in discussing it. A point of note is that those patients who have had a heart attack, if they're worried about sexual activity after a heart attack, if you're able to climb safely 2 flights of stairs without developing chest pain or breathing difficulty, sexual activity should not be a problem. When it comes to returning to work, the guidelines are not very clear, but we generally, as a practice, tell patients to wait for about 4 weeks or so before they return to work, have a couple of follow-up appointments, and then decide. Some patients take up to 6 weeks, some patients have taken only 2 weeks, but it depends upon the severity and how they've been affected. So there is no harm in asking your doctor regarding that. Finally, I just would like to make a point of the impact of lifestyle modification. It has been proven time and again that if you modify your lifestyle appropriately with the steps I have explained to you so far, that you can reduce your risk of heart disease in the future, specifically if you have diabetes. If you do suffer a heart attack, what you want to do is take every step possible to prevent yourself from getting another one. So make sure that you do every sort of lifestyle change possible, and by doing so, you should be able to protect your heart and lead a long, healthy, and fruitful life. I thank you for your time.